Good morning, everyone. My name is Logan Oxenham, and I am your MLA right here in Kirkfield Park. Now, before we begin, I'd like to honor the sacredness and the importance of this land and the ancestors that once walked where we are standing today. The Anishinaabe, the Inuiaq, the Dene, the Dakota, the Inuit, the Anishinaabe nations, and the Red River Métis Nation, who paved the way to what is now known as Manitoba, home to all treaty people. The reason we share this information with you is that it's a reminder of our treaty histories and the original homelands of all those nations, which have become home to all of us here today. Today's announcement furthers our commitment to rebuilding Manitoba's healthcare system. To start us off today, please welcome the Premier of Manitoba, the Honourable Wab Kinew.
Thanks, Logan. Well, today we're celebrating a record 45 new ICU nurses in Manitoba. And we're also celebrating ICU nurses generally. Thank you for all the amazing work that you do to take care of us. I think so many of us have these stories of loved ones, people that we know very well going through some tough times. And it's the person at the bedside providing that one-to-one care that makes a difference in so many of those stories for the better. So as somebody who's been there as a loved one or a visitor, I just want to say thanks for what you do each and every day as nurses. We're working hard to support you and to give you the support that you need to be able to do the jobs that you've stepped up for. For many years, healthcare in Manitoba, and the ICUs in particular, were under strain, and it was the nurses and other staff who worked there who bore the brunt of that. In fact, at one particularly difficult time during the pandemic, we actually lost the ability to care for the sickest folks in our province, and we had to send some of those patients out of Manitoba. So we never want to get in a situation like that again. And it all comes down to the people. It comes down to the nurses and the physicians and the allied health professionals who work in our ICUs to be able to answer the call as they do so wonderfully each and every day. So this announcement of a full cohort completing this ICU training program is really great news. We want to thank everyone who's been doing this training and is nearing the completion. And we want to thank the folks who've been working in the recruitment and retention office to ensure that all these positions are filled. Because we're going to have to keep doing this. This is an important milestone for sure. But we need to keep training more and more and more to be able to complement those who are already working at the bedside and doing amazing work. So on behalf of the province of Manitoba, I just want to say everybody out there appreciates the work that you do, and we thank you ICU nurses each and every day for the amazing contributions to our province. Miigwech merci, thank you very much.
Thank you so much, Premier, for your continued efforts to strengthen our healthcare system. Next, please welcome the Minister of Health, Seniors and Long-Term Care, Uzoma Asagwara.
Thanks, Logan. Appreciate that. Hi, everyone. Really exciting day to be here. We know that today's announcement is about people, and it's about people who make critical care possible in this province. I also want to shout out the leadership here at the Grace. They are some of the best leaders we have in the system, and they have been working tirelessly in partnership with our government to make sure that we're moving staffing in the right direction. They've done a great job at this site, retaining, training, recruiting, getting the word out to communities that working in healthcare in this province is a calling, and it's a wonderful and rewarding career choice. So I just want to say thank you so much for all of their partnership and leadership. And so this spring, 45 nurses are completing the specialized ICU training and preparing to join ICUs across the province. In just a few short weeks, they're going to go and provide care at the bedside for some of our sickest Manitobans. As a nurse myself, I can tell you that being an ICU nurse is incredibly specialized. It takes really special, highly skilled people to do that work. And it's phenomenal to see that after years of these seats not being even close to filled, that we have nurses who are stepping up, putting their names forward to choose this path, to choose this calling, to provide care to our sickest and most vulnerable Manitobans. And as the Premier said, we cannot thank you enough for making that choice. Being joined here today by so many incredible nurses who have stepped up to make that choice is a humbling moment. And I think it's a testament to how hard we've all been working together to make sure that nurses see this as a really rewarding and accessible pathway and opportunity. I think that it's important that, folks pay really close attention to when we announce beds in the system. When we say that we've added critical care beds, which we have, we're not just talking about beds. We're actually talking about people. We're talking about fully staffed beds, but people at the bedside who are experts in delivering that care each and every day to Manitobans. And, how we've gotten here is largely in part to listening to nurses. It's nurses who came forward with some really key ideas, some strategies in terms of how we can expand ICU capacity in this province. We heard that we needed more critical care capacity. We heard that these seats need to be filled. And we heard loud and clear from LPNs that they wanted access to this opportunity as well. And so last year we made that possible working with our partners, and LPNs have joined these training cohorts and are joining the front lines at the bedside in critical care units. And so I want to say thank you to LPNs for raising their hand, for wanting to be a part of this and pursuing this as well. So as the Premier said, our job as government is not anywhere near done. We need to keep seeing these seats being filled. We want to make sure that we continue to build on this momentum. We know that our job is to make sure that there's opportunities available for these nurses, and there will be, of course, moving forward. But I am happy to say that since forming government, we have fully funded and fully staffed an additional 28 ICU beds across Manitoba. And expanding that ICU capacity came from nurses. It was nurses who put the proposal in my hand, who stopped me at events where nurses were attending and said, this needs to happen, and we know if we work together, we can get it done. So we're going to keep working with nurses, listening to nurses, working with leaders. Our retention and recruitment office is going to keep building on this momentum. We know that for the most recent ICU training intake, we had more than 80 nurses apply for the program, which is phenomenal, just great. And we also know that even though maybe not every single applicant is ready right now, that it's important to support them and make sure that they can get ready. So if folks are not quite there just yet, they need a bit more preparation. Educators and site managers are actually maintaining active lists of interested nurses and supporting them so that they can become eligible for that next round of training. And so as that pipeline continues to grow, applications are now open for the next critical care training cohort, which begins May 4th. So I encourage folks to put their name forward, reach out. You've got folks who will support you every single step of the way to make sure that you can be successful and join ICU, join these wonderful ICU teams. So the last thing I'll say is, and I say this often, but rebuilding healthcare is not about buildings and beds and infrastructure. It is about people. It's about staff on the front lines. It's about that nurse at the bedside providing care in the time when you need it. And so we're going to keep listening to nurses, working with our partners to make sure that Manitobans have more of these phenomenal experts with them in their care journeys. So this is an exciting day. Let's keep doing the work of fixing healthcare and making it stronger together. Thanks, folks. Thank you.
Thank you so much, Minister, and thank you for all the work you do in rebuilding healthcare. I just want to welcome next the CEO of the Winnipeg Regional Health Authority, Jane Curtis.
Thank you. I'm grateful to be here today recognizing ICU nurses being added to the healthcare system. We know that staffing and capacity levels remain the top concern for nurses across our system. Recruitment and retention of nurses in all sites and areas of the healthcare system is a key priority for the Manitoba government and for the WRHA. And these additional ICU nurses are such an important element in our efforts. ICU nurses take care of the sickest and most vulnerable patients in our system. And the ICU also plays an essential part in how our overall system performs. Having more ICU nurses allows us to always have fully staffed ICU beds and greatly reduces our need to rely on overtime and mandating. In times of surges, such as trauma and respiratory virus season, Having access to fully staffed ICU ensures the best care for the sickest patients. This is a critical part of reducing crowding in emergency rooms and supporting patient flow across the entire system, helping ensure we are always ready to provide the best care for patients in all areas. In addition to ICU nurses, I'd like to add that Rochelle and her team here at the Grace Hospital have been able to reduce their overall nursing vacancy rate from 40% in 2022 to 12% today. And we keep... This is an incredible achievement, and they're not stopping now. While these numbers fluctuate, this reduction represents the hard work of the leadership team and all the staff here at the Grace, and speaks to the culture that they have built. Thank you for all your hard work. I would also like to thank the Manitoba government, Premier Kinew, Minister Asagwara, for your investment and effort into the recruitment and retention of nurses and healthcare staff, and the future of healthcare here in Winnipeg and across Manitoba. And finally, I want to extend our deepest gratitude to ICU nurses, as well as nurses across our system, healthcare providers, and other professionals and workers. You are the heart of healthcare, and I want to thank you for taking up this calling and being there when people in the communities we serve need you most. It is truly an honor to work with all of you, and I look forward to continuing to work together to improve healthcare for everyone. Thank you.
Thank you so much, Jane, for your leadership and your dedication. That concludes our announcement. Thank you to everyone who is here. And a special thank you to the nurses who are standing with us today. We will now open the floor to questions from the media.
Maybe for Jane Curtis, can you just have some more details about this type of ICU training program? Like, how many times does it happen a year? How many weeks is it? How do you get into it?
I might actually ask one of the leaders to speak to that, if that's okay.
Hi, guys.
That's awesome.
Sorry, can you repeat the question?
Yeah, I just want some more, and also if you could introduce your name.
For sure.
As well, that'd be great, and the spelling as well. But
Okay.
I want to get a sense of this program. How many weeks is it? How many times does it happen in a year? What do you learn?
What do you learn? Okay. How long do you have? So my name, for sure. My name is Chantal Pakulak, last name Pacakulak. I'm the coordinator for critical care education. Very excited to be here and celebrate the nurses that are here. They're absolutely incredible. They're doing a very hard thing, and they're doing it with just grace and kindness and compassion. Out of a sense of purpose and for the care of the patients that we look after. So ICU training happens 3 times a year. We have intakes in January, in sort of approximately May, and again in September. It lasts about 15 weeks. And the way we divide it is really balancing that theoretical learning, learning those advanced pieces of knowledge, advanced cardiovascular, respiratory skills, balancing it with clinical time on the floor. So the ICU nurses that work every day on the floor are so very vital to the orientation and just integration of new ICU nurses within the units. Is that fair?
Yeah.
Okay.
If 45 is the record, how many people normally take this program?
It fluctuates based on the year and the time of year. Anywhere between sort of 6 and sort of 35 is our general. So average probably about 26 to 28.
What do you attribute the difference? Why do you think there's been more this time?
You know what, honestly, if I knew the reason why we had more this time, then I could replicate it in the future. That would be super. Honestly, we're really trying to promote the course. We're trying to encourage staff who may not feel ready to come and talk to us about it, encouraging staff to do shadow shifts to see if a career in ICU nursing is something that they would enjoy. And then we're looking into the data to see if we can find some trends and seeing if we can keep this going.
Can I speak to that really quickly? Sorry. Can I just offer something in addition to that? Thank you so much. So having incredible educators and coordinators, right, like this brilliant person, makes a huge difference. We know and we heard very clearly that nurses wanted more mentors. They wanted more educators available to them. So having educators who have stepped up to be in those roles and have really taken this on and have supported all of these learners in being successful is fundamentally important. The other thing we've done is we gave the Retention and Recruitment Office a mandate to work with our partners to ensure that we're doing everything we can to get those seats filled. And so everyone's rowing in the same direction. Everyone recognizes that we've got to do everything we can, outreach, mentor, work with the RRO to get those seats filled. And again, I said it in my remarks earlier, that even if someone isn't eligible or ready just now, we're going to actively work with them to make sure they're ready at some point soon. So if you have an interest, put your name forward. We're going to make sure that people are mentoring and supporting you so that you can join at some point. And it's everybody working together to recognize that we got to get these seats full, keep them full, and build on that momentum.
What's the maximum number that you could have in a cohort?
65. Sorry, I apologize. 55. 65.
165.
165 total. That's where that number is coming from. 55 per cohort.
Oh, yeah.
Yeah.
55 times.
Times 3. Yeah. Quick math.
Do these 45 nurses already have jobs that are waiting for them in ICUs in Manitoba?
Yeah, that's right. They do.
And like, do you know where they will be working throughout the province?
Yep, we can give you a breakdown of that, but there's going to be nurses at the Grace, there's going to be nurses in Brandon, HSC, St. Boniface as well, I believe, so Dauphin as well. So we're making sure that we're looking provincially in terms of where these opportunities are to staff, and also making sure, you know, the Premier and I very early on started sending letters of offer, job offers in graduates' hands before they're done their training, right? So that has really rippled throughout the system. Folks are really being proactive, making sure that nurses have jobs before their training is complete across the board, that they know about the opportunities in Manitoba, and that we're really also focusing on those maybe harder to staff sites so that their needs are also being met.
With this class or this cohort, do any new beds open as a result of these additional staff coming to ICUs?
These nurses are going to staff the existing beds. There's a few additional beds that we are looking at bringing online, particularly in Brandon. But we know that actually the critical care has been historically one of the most difficult areas to address those vacancy rates. Those are the area with our largest vacancy rates. So for us, you know, the momentum that is building through 2.5 years of everybody working together is we're seeing that now. And again, you know, these are nurses who are now going to join the front lines and hopefully share the good word about their experience and their pathway, encourage other folks to join. We're not going to take our foot off the gas on this. It's an area that we know needs to be addressed. We lost critical care beds under the previous government. You know, it wasn't that we just ran out of capacity during COVID to take care of our sickest Manitobans. Beds were actually cut from the system. We lost critical care beds. We lost ICU nurses. So we've added back capacity with 28 fully staffed beds, and we're continuing to do the work of adding more nurses at the bedside.
What about vacancies for other positions in ICUs, like respiratory therapists? What are vacancy rates like?
We can get that for you offline. What I can say is that respiratory therapists, you know, our priority is making sure that we're staffing across the board, right? So our priority is ensuring, of course, that we've got great easy pathways for nurses to join the front lines in critical care, but to your point, we need more respiratory therapists. That's why we doubled the training seats for RTs. We know we need more healthcare aides on the front lines. We know that we need more physiotherapists in the public system, right? Though they were cut by the previous government out of the public system. So we're going to keep building across the board. We want more healthcare workers of all kinds, as Jane said earlier, at our sites. And we're seeing, again, a net gain. We just got to keep that going.
Will the province be offering more training for pediatric nurses?
Oh, yeah, absolutely.
Just given like what's going on in the last week with my father, an 11-month-old baby that's discharged from the hospital, and you know, we're kind of wondering what's going on with that.
So what I can tell you is that actually it was pediatric ICU nurses who brought the idea forward for us to add more beds in critical care. And so it was those nurses who brought forward a proposal to say, listen, we know we need more critical care capacity for our sickest and youngest Manitobans. here it is, take a look at this, and we work directly with them and with the employers to add those beds, fully staffed beds. And so I can't thank these nurses enough. You know, when they speak up and bring ideas forward, we can work together to make them happen. So our priority, again, is making sure that critical care across the board is moving in the right direction, which it is, including pediatric critical care.
Can a nurse enter ICU training immediately after school, or do they need some training in other?
I'm going to get our expert back up here to answer that.
So one of the requirements for ICU training is 1 year of acute care experience. So we really, really like those nurses to have some of those strong baseline foundation of a knowledge of how to interact with patients, how to do some basic critical thinking before we start layering on the more advanced topics.
Do they have to go into this ICU training?
No ICU training. So what happens is positions are posted for the intake. They apply at the site that they would like to work at. They get hired into the site, and it's paid training. So they get paid full-time while completing the training.
For the nurses who take this training, I guess, the positions that we're leaving behind, what happens to fill those? I'm sure that's little vacancies there.
Oh, sure. Maybe I can answer that. Do you want to take that, or?
No, you go.
Okay.
Well played.
That's a really great question. I mean, again, this is why we're not taking our foot off the gas. We're making sure that we are retaining, first and foremost, training and recruiting as many nurses as possible for all areas. We know that there are some key areas that we need to really staff up, ICU, critical care being a big one. But we also know, to your point, that when a nurse leaves, any particular area to pursue this opportunity, we need to make sure that the nurses know about the opportunity available to fill that position. And thankfully, we're in a position now where we're hiring net new nurses in this province. For years, we saw a net loss of nurses under the previous administration. We're in a position where we're training more nurses right now than we ever have in our province's history. We're retaining more nurses than we have. But announcements like this are so important because it lets people know about the opportunities that exist. It reminds people that we're going to make sure we're staffing up in all areas. And it also lets nurses know that help is on the way, right? Nurses who maybe have been, fatigued, looking for that nurse to their left or to their right can see really tangibly that there are nurses who are joining them on the front lines who will be helping them provide great care and lighten that workload for them.
There was a report today about an internal memo that I guess was shared within Shared Health and the WHO, explaining that public wait time estimates for Winnipeg emergency departments can often be quite inaccurate. When did the province become aware of this, and how is it responding?
Yeah, so this was something that was flagged months ago now. I want to say sometime in the summer it was flagged, highlighted. So several months ago now, it was identified that there's the way that data had basically been capped in terms of folks presenting to emergency departments. This is a historical practice. We're talking, 8-10 years old, and that approach had never been changed. So when it was flagged, and it was flagged by physicians actually who recognized the issue, immediately started doing the work. The experts started doing the work of fixing that. We know it's really, really important for Manitobans to have accurate information when they're looking at wait times. If you're a parent and you need to take your little one to an emergency department, when you look and see what the ER wait times are, you should be able to trust that information is accurate. So you make the best decision for your family and for your little one who needs care. That wasn't happening for years. This information was not brought up to date. So the work under us over recent months has been happening to fix that. But it's a historical issue that we're rectifying as soon as we were made aware.
On a different Premier, regarding Richard Maddox's salary, the government initially said it was $387,000 Canadian. We now know it's $387,000 American, but that's the base salary. There's stuff on top. Was there perhaps a miscommunication or a misstatement at first when it was told that it was Canadian funds?
Richard Madden's doing important work for all of us here in Manitoba. He's our man in DC, if you will. And this is the cost of doing business under Donald Trump. We've seen a real impact because of the tariffs. We've seen a real impact now because of the war in Iran. Gas prices are up. Cost of living is up. It was already a challenge. So This is an investment in trying to wrangle Donald Trump into the direction of common sense. So that's what we're working on. Media questions you can direct to Capcom and stuff like that.
Do you have any explanation, though, for the discrepancy between the salaries?
I think Richard Madden is doing important work for all of us, and this is the cost of doing business under Donald Trump.
Can you elaborate on some of the work that he's doing, like some of the counterparts?
Sure.
that he's meeting with?
Yeah, I met with Canada's new ambassador last week, Ambassador Wiseman. Very sharp guy, and first thing out of his mouth basically is that Richard Madden is doing an amazing job right now. So that should give reassurance to Manitobans that the person we have acting on behalf of our province in DC is doing a great job. And this was cut under the last government, so it wasn't unique to healthcare. They were cutting everything, and it left us unprepared for Donald Trump 2.0.
Doing what though? Like what are the benefits? Are Manitobans getting their money worth? So what is he doing? What are the benefits? What kind of deals has he secured, or what are the benefits? What has he done?
Is that everything? Okay. There's one deal that matters. CUSMA, USMCA, right? We got to preserve our exemption for Manitoba exporters under the CUSMA deal, and so all the effort is geared towards that. There is a review process with a deadline of July 1 that we're looking ahead to, and so Mr. Madden is meeting with all of the folks in Capitol Hill. We're certainly assisting, talking to state houses across America, and with the administration as well. So this year will be a very, very crucial inflection point in the nature of the relationship between Canada and the U.S. We know that Donald Trump has already ripped up this deal, and he's basically antagonized everybody in this country. So for us, it's important to have somebody there around the clock, making the case and advocating for us.
Who has he met with in the administration?
Well, as you know, we don't necessarily share all the details, but I'm sure if you ask some of our colleagues in Capcom, they can provide you with more.
Regarding the police headquarters inquiry, Abi Khan ended up taking a photo on the weekend with Bobby Kanyas. I understand you taking a photo with John Garcia. Do you think those photos are appropriate? Would you take a photo with Bobby Kanyas?
Can you spell out what you're getting at for me?
I guess I'm getting at, considering the role these individuals would have at the police headquarters and the issues that have arisen from it, if there is a place for politicians to take photos with these individuals.
In the context that I called the inquiry into the Winnipeg Police Headquarters?
Yeah.
Right. Well, I called the inquiry into the Winnipeg Police Headquarters because I want to get to the bottom of any wrongdoing that took place. So, yeah, I don't know. Is there more to it that I'm not connecting in my mind? Yeah. No? Sorry. That's not super clear on if there was a specific angle you wanted to go.
A little bit of like the perception of taking a photo with individuals that haven't. Do you see any?
Well, you mentioned an individual like Abi Khan, whatever. But me, I was at a very high-profile event, and they sat me across the table from a whole bunch of people, and I was happy to take photos with all of them. So, but in terms of wrongdoing related to the Winnipeg Police Headquarters and the City of Winnipeg, City of Winnipeg's always asking for these huge investments from all of us, right? The North End Water Pollution Control Center, for instance, is a multi-billion-dollar investment. I just want us to understand what went wrong with the Winnipeg Police Headquarters before we potentially see similar mistakes made on other big construction projects. So that's why we got the inquiry going on.
Just getting back to Richard Madden's contract, what is that base amount and base salary that he's getting, and what's on top of that?
I've already directed all the specific details to be followed up offline.
Want to go to Zoom?
We can go to Zoom.
Thank you, Premier. We have two outlets on Zoom today, Radio Canada and Brandon Sun. Maggie from Radio Canada, go ahead. One question, one follow-up.
Oui, Monsieur Kinew, quel impact est-ce que ces nouveaux infirmiers de soins intensifs auront sur le système de santé au Manitoba?
Bien, les infirmières dans le système de soins intensifs auront un rôle très important pour améliorer notre système de santé. Nous avons vécu déjà dans un système avec beaucoup de défis pour soigner les plus malades dans notre province, mais avec cette addition, avec 45 plus d'infirmières, c'est une étape vers un avenir où tout le monde qui se rend aux hôpitaux dans le Manitoba seront capables de recevoir le soin qu'ils ont besoin.
Merci. Et là, sur autre chose, est-ce qu'on peut avoir votre réaction en français à l'annonce de la rémunération totale de Richard Madden, comme vous avez dit tantôt en anglais?
Bien, M. Madden, il fait un grand travail pour tout le monde dans le Manitoba. Et puis, je trouve que c'est un défi qui a été créé par M. Trump. Alors, on ne veut pas se tromper. Alors, nous avons embauché M. Madden pour nous aider.
Okay, thank you. And Brandon Sun, Tessa, go ahead. One question, one follow-up.
Thank you. You mentioned that there will be some nurses from this cohort that will go to Brandon and Dauphin. I'm just wondering how many there will be.
4 seats dedicated to it, but do we know that there's
6.
Yeah.
Oh, yes, everyone's got it.
Go ahead.
Yeah, so we've got 6 nurses who are dedicated for Brandon. And it's really exciting. They do incredibly important care, obviously, in every ICU, but we know that that's busy. It's a busy ICU, it's a busy site. So looking forward to not only welcoming those nurses, but additional nurses in Dauphin and more nurses as we move forward, as more nurses get trained.
Thank you. And I spoke to the Prairie Mountain Health CEO in December, and she said that Prairie Mountain Health needs to fill its current ICU vacancies before it can open all 16 beds for its critical care center. And I'm just kind of curious, when does that critical care center expect to open, and how will it be staffed to eventually get up to that 16 beds that's planned?
I mean, our priority is making sure, as I think as people have put together, we are taking a very methodical, sustainable approach to staffing. We are opening fully staffed beds in the system. So, we're going to open those beds at every opportunity that we can as they become fully staffed. So that's our priority, is making sure that we continue to see full cohorts of ICU nurses being trained. Again, we've got 80 plus nurses who have signed up to take the next training. And we're going to make sure that as many nurses as we possibly can know about the opportunities in Prairie Mountain Health. We get those job offers in their hand before they're done their training, get them out there for a visit, build relationships. And, the other thing that I think is really important to note here is we want to make sure that nurses are getting out early to these sites to get some experience and feel comfortable. So the Grays took the step of having on-site training, which I think was a really smart one and has made a difference. So we're looking at ways that we can also encourage nurses to get out to rural Manitoba, build those relationships proactively, and also, have nurses who come from rural Manitoba taking this training and then going back to their communities to serve in those roles.
Thank you, Minister. That's everything from Zoom. Back to the room.
I hope on Supervisor side.
Yeah.
Well, it's about a week and a half ago, might be a week or two away. So wondering about a timeline update on that. And further to that, can you explain because you initially thought it would be federal approval was required, and then you realized that that's no longer the case. Can you explain what breakdown happened there?
Well, let me just deal with the first question, and I probably will hope that you forget your second question in the amount of time I take on the first one, just in the name of transparency. I can't really give you a timeline. We've taken a look at the current offer for the supervised consumption site, right? And us now having this kind of blanket federal exemption and being in a position to I guess, set our own provincial priorities for what we're trying to do here, which is basically to provide a healthcare service. We are going back to the service provider, which, as you know, is Aboriginal Health and Wellness, and asking them to respond to our requests for how are you going to fulfill these needs, which, again, the highest priority need is you have people who are living either on the street or very close to the street in a really rough condition of addictions, and they're ending up here, or they're ending up in hospital beds in the wards for hundreds, in some cases thousands of days. Other folks are giving birth to babies with STBBIs, which frankly didn't exist in Manitoba 10 years ago. So there's all these sorts of different healthcare interventions that we're trying to make as part of an overall healthcare approach. In the process of us shifting from a federal to provincial approval, I have realized that I want this thing to be done right. I don't want it to be done quickly. If it could be done right, according to a quick timeline, that would be wonderful, but it's not looking that way. So before we do take this very significant step, which is effectively to have a localized exemption for the criminal sanctions against illicit drug use, I want to make sure that the healthcare offer is super, super strong. When we first started talking about the supervised consumption site in opposition, in my mind, I pictured a facility that would look like an Apple store. I thought it would be full of nurses and paramedics and nurse practitioners on the inside. Now, we've started the process of designing a service around the existing service provider that's put their hand up and said, we see the need, we have extensive expertise working with this population, and we want to be able to work together with you. Now I think the challenge for us is, okay, it's no longer the feds providing this thing. We, the province, are the ones actioning this. Let's make sure that that vision is going to be matched as closely as possible by reality. So in the process of doing that, I think the last time I spoke about this, you know, the idea of moving from federal to provincial regulation was maybe like a day old in my head. Now that I've sat with it for a few weeks, I want to get this thing right. We're talking about a significant step here. And we owe it to the people of Manitoba to make sure that every single consideration around healthcare, around the health of the people potentially using a future facility, around safety on the surrounding community, and of course coordination with the healthcare system, with law enforcement, with the fourth order of community response, basically DCSP type organizations, that's all really coordinated. Our minister has done an amazing job of bringing all those organizations around and creating a comprehensive plan, but there are still some very, very serious issues that we need to straighten out in the due diligence before we open this facility.
Are you confident that this provider can do it? You know, the faith and confidence might be need some help.
Well, we'll be helping them. We'll be working with them on this. So it's not just like here's our list of provincial priorities, and then it's like an exam or something at university, right? This is an iterative process. So we will be hearing from them, I think, in the next few days about their initial response. If we have concerns at that point, then of course we'll be very direct in saying, okay, is what we heard from you, but actually here are the goals that we want to see in terms of tying people into recovery or tying people into services, or here's some of the coordination we want with some of the broader healthcare facilities. Keep in mind that there's a WRHA clinic like very, very close to this. So are all those linkages and pathways open? You know, are the health folks in that facility prepared? You know, is the 911 service prepared? These are all a bunch of detailed questions which initially were part of the application to the federal level. Now that it's on us as the province, we want to make sure we get them all right.
Are you confident, though, that this provider can do it? That this relationship going back and forth between the provider and the province will lead to those supervisors?
I think the folks at Aboriginal Health and Wellness are great people with a phenomenal relationship with this patient population. People who are living in that area around Maine and Higgins, people who are living a very tough life, in large part because of addictions, but also because of, you know, drug trafficking, human trafficking, historic trauma, and many other factors. The question for me, though, isn't what I believe or how confident I feel. The question for me as a leader of the provincial government is, show me. Prove it through your design of policy, of training of staff, and through delivery of service, right? So that's really where it's coming down to now. So I appreciate your question, Ian, about, what are my thoughts on this organization? I can tell you without reservation, I think the world of this organization, but it's not about that. It's not about my opinion or my belief. It's about what are you going to show us on paper, what are you going to show us operationally, and what are you going to be able to deliver for somebody who's stepping in the door and saying, listen, I know that this is something that I need help with. Help me stay alive in the first instance, but also what else can we do here? Whether it's connection to primary care, connection to treatment and recovery, or connection to social services that might help people turn their life around too.
For the permanent site where you do need that exemption, do you think that will open this term, or do you think that's something that will probably have to wait until a second term should you get one?
I hope we get one. Political considerations are not appropriate for a health intervention of this magnitude. It has to be guided by what's in the best interest of the public. And so I fully appreciate that, your outlet and our government have had a lot of interaction on this, and we have talked a lot about year one versus year two versus year three. But I think I would just say that at the highest level right now. It is very clear that we're on the precipice of taking a very important step that we believe will help save lives and tie more people into better health care, so that not only the impact on them, but let's say, again, an HIV patient who may cost the provincial healthcare system $1 million more over the course of their lives might actually, shortly or before being born, receive a pharmaceutical intervention that could prevent them from contracting HIV from their mother. Right? Like, that is the scope of health intervention that we're talking about here. And so I think we do a disservice if all of a sudden it's like, okay, well, elections are around the corner, let's get it done. Right? The first step that's before us is this temporary facility. Switching to provincial jurisdiction has presented a whole host of complexity, and so we're going to just take the time to get it right. And that permanent facility, hopefully, hopefully it's the right thing to do, and God willing, we'll be in office to be able to do it, I would say. Yeah.
Maybe just to follow on that, but are you confident that your election promise to open supervised consumption site will still happen, even at a temporary level? Will this temporary structure still happen?
Yeah. But, let me parse the words of what you're saying. I'm confident that we will deliver on our commitment to have supervised consumption as part of a health-led approach to responding to the addictions crisis. What we're in now is a transitional response to finding more information about the regulatory structure, and now wanting to push it as close to the vision that I had originally, which is I want this, when you open the doors, for you to feel like you walked into an Apple store. I want it to be spick and span. I want it to be a serious healthcare facility staffed by high-functioning, high-achieving healthcare folks who understand not just the cultural and community context, but also, I think, everything that the evidence and that their experience and practice would show them that they should know when they're dealing with the most vulnerable in our society. And so, yes, this might take more weeks, a few more months in order for us to do this, but I think it's necessary because it will lead to better outcomes for the person potentially using the supervised consumption site in the future. But we also have a responsibility not just to think about the person who's addicted, we have a responsibility to think about the entire society. We have to think about what are the safety impacts on the community in which the site is going to be hosted. We have to think about what are the first responders and the good people such as you see behind us today in the healthcare system going to potentially have to deal with as we bring on a new healthcare service like this. And then, of course, we have to bear in mind the confidence that Manitobans have in this type of approach to dealing with addictions in Manitoba. So I've long used the phrase, a supervised consumption site is like Buckley's cough medicine. It tastes awful and it works. The rationale being, if we have a supervised consumption site, you, the average person out there, you might not like the idea of illicit drug use being taking place under the supervision of trained clinicians and medical experts, but the evidence says that this is an important way that we can add to our provincial toolkit to save lives and to help people turn their lives around for the better. That said, if this thing is done sloppily or it's done poorly and it reverses that open-mindedness that I think Manitobans have right now, because again, they did elect us on this commitment among others, then it's just going to undo the whole progress that we're trying to make when it comes to addictions in Manitoba. So again, I recognize that there's a whole advocacy community out there who wants this site to open quickly. You have a lot of opinion writers and I guess talking head types who've invested their own political capital to saying that this is something that is worthy of support. But when you think about the broader society and the necessity of us all to continue making progress against one of the worst things that we're grappling with right now, which is a toxic drug crisis and the addictions problem more generally, we owe it to Manitoba to take our time to get it right. So again, all credit is due to the minister and the great people who work on the front lines trying to help these folks. Any blame or any quibble or quarrel that you have around the timeline is properly directed at me.
I just wonder if you could just all français on
The whole thing? Okay. All right. Well, une des considérations les plus importantes, c'est que nous avons vu un changement de l'environnement au niveau des régulations. Et puis, en tant que votre gouvernement provincial, nous pensons que c'est très important de prendre le temps de créer un service qui avance la santé de la communauté. C'est-à-dire, oui, si on pourrait le faire de façon très vite ou quoi que ce soit, je serais d'accord avec ça, mais c'est plus important d'avoir une approche forte et qui aurait un qui gagnera l'appui de la plupart des Manitobains et Manitobaines. Merci beaucoup.
Thanks,
All right.
Thanks, folks.
Thanks, everyone.
Thank you.